All right. So my name is Todd Ketterman, and it is my pleasure to introduce this group to two of my favorite people on this planet, Gene Bowen and Jack Bookbinder. They're going to go through road recovery and what it is. I've been involved with road recovery, what, 20 years, 20 something years? Yeah, right. So we won't go into that. But just an incredible organization, New York-based organization that works with kids, as you saw, that are struggling with adversity, different life adversities, and providing them a way to recovery through it. Just amazing. Just these guys have given their life to this, and it's been amazing for me just to be involved. When I met Jack at an event, he was introduced to me, and I remember just thinking, and this was what, 2000 something, early, and like, wow, man, I would just love to be helping them out somehow. So to be thinking that I'm sitting here on a stage introducing them is just, words can't explain it. But without further ado, I want to turn it over to them, let them talk a little bit about road recovery. Jack and Gene, thank you.
Thank you, HealthIMPACT, for having us, and all of you for sticking around. My name is Gene Bowen, Jack Bookbinder. So about 30 years ago, we both were going to NYU, didn't know each other, but a professor there connected us. Jack was in the management side of artists, and I was in the tour management, touring with artists. We came together and worked with the Allman Brothers and Greg Allman, and at that point, my adversity really took off, which was addiction. From basically a kid who was just filled with fear, and thank God for drugs and alcohol, because I made it through adolescence. And then, but at some point there was that I crossed the line and into full-blown addiction. Jack's a diabetic. And we worked together with these classic rock musicians, and then I crashed and burned. I got sober in 1992. I'll be 34 years sober next month. Yeah. And I ended up going and working in the classical music world, which there are more crazy people in the classical music world than there ever will be in rock and roll. I can attest to that. But anyway, so Jack and I slowly came back together when I was 2 years sober, and Jack had signed a very high profile artist on Sony, and then asked me if I would tour manage this artist, which basically led to a 2-year world tour. I had a sponsor who was a plumber who said, you should go in and lay your cards on the table and ask of Sony and the band and management of what no one else has asked for. And that was basically, if it gets squirrely out there, no questions asked, you go home before you die. Be careful what you ask for. I got that. But the mutual agreement was that I would break my anonymity and allow everyone through the Sony system worldwide, because it was a worldwide tour, of my lifestyle. And also Jack would also talk about his. And so for the next 2 years, wherever I went, people from our industry all over the world came forward and talked about having dyslexia, having lost a loved one through mental health, dealt with poverty and growing up, whatever the adversity was. And after 2 years, we started talking. We were like, wow, we're seeing our industry in a completely different light, that there's a resource here that as fashion and music plays such a role in influencing young people, there was an unspoken voice from our industry that needed to get out to share that with young people. And since we all know engagement and everything with young people, you can't sit on a couch and talk with each other. You have to engage young people at all times. So what we figured out was, like, how could we engage people who make their living in the live performance and the recording aspect of it, to work with these young people. But there was a catch, which took a couple of years. And from both of our experiences, the healthcare world, people in white coats played a massive role in the success of us living healthy lives. And for me, mental health professionals and medical professionals in terms of dealing with this disease of addiction, and Jack, an endocrinologist. The task for us was, how can we bring two unlikely characters together, the entertainment industry and the healthcare world, to work with at-risk youth. and create a mentorship program where we could stay in our lane, but wrap around the services of professionals who could handle any situation that arises with the young people. So it took about 2 years to convince a whole lot of people that, how can these two worlds come together? This is kind of crazy meets, sane. But we did. And 1998, we launched Road Recovery as a means of teaching basically three very important components, and that's coping skills, communication skills, and life skills. And the way we do it is there are three components to everything we do with the kids. First, we come together and we share what's going on in our life. And to create intimacy, and one needs to be vulnerable. And so from people from our industry who are not the police or not the authority, we're willing to be open about the adversity that they had dealt with their life and the solution that they are living, created a safe environment for young people to start opening up and talking about what was going on in their life, and start to figure out ways of dealing with these issues as well as how to express themselves. And then to create that, to elevate that voice, to validate their voice or whatever they're thinking about, or whatever they're going through, to create a space where they could collaborate together and elevate that voice through using the best technology and such that the entertainment industry has to offer, and then present that to their community. There's nothing better than youth talking to youth. It's without parallel. We always say to the young people, we're Charlie Brown parents. We're wah, 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 right? I'm 61, right? But you will save each other's ass. And so in planning and executing their performance, their place to share with their community creates life skills, right? We all know, anyone who deals with young people, instead of choking them, you have to repeat, right? In order for information to sink in. So we work in 12-week cycles where we're working toward an end result, which is a performance or a celebration. So we work backwards each time we meet with the kids. What have we accomplished? What are we trying to do? What do we need to do today? And creating that safe space and giving them a voice and elevating that voice and validating that voice is the essence of what we're about.
Yeah. So interestingly enough, knowing these guys that are way cooler than I ever could be. So I'm this technologist guy, having fun, going out and listening to music with Jack and just trying to be around two really cool people. And I'm getting closer to the organization and hearing what's happening. And I always have an idea, right? I mean, as a technologist, we're saying, how do we solve problems? How do we solve business problems with technology, right? So I'm listening to these guys over and over again talk about some of the challenges they're having. And one of those was that, and this had come up, they're constantly working with these high-end artists, big artists, and they're trying to set up these meetings with the kids, right? They come into town, they play, they're at Madison Square Garden, and then they're gone. So they'll make a commitment. Yeah, we can see you. We'll do a meet and greet. We'll talk with the kids. We'll spend time. The day of, sorry, we can't be there. Sorry, we got something, right? Happened over and over again. So one of these times, something was coming up, and I said, what do you guys think about? Do you know anything about telepresence? And they're like, what are you talking about? And I said, well, wait a minute. Where does Slash live? And they're like, well, he lives in L.A. And I'm like, well, there's a Cisco office in L.A. and you guys are here in New York. So why don't we get Slash to come in to Cisco and have the kids go here in New York? And I had some friends at Cisco, and lo and behold, we set it up. Slash agrees to do it. Cisco agrees to do it. They literally shut down the Cisco office in LA. They call me. So I'm going out there and they call me and they said, oh, you have to be Slash's handler. I'm like, what are you talking about? I don't even know what that means. Right. They said, well, you're going to greet him. You're going to go downstairs. You're going to meet him. They're going to bring him upstairs. You're just going to get him what he needs and whatever. So here I am at Cisco. This is kind of an urban legend, but this is true. So we bring Slash in to Cisco in LA. All he wanted to do was stand around and talk about his two kids and eat chocolate chip cookies. It's a true story. And then he went on with the kids here in New York, and they played music through this telepresence connection, right? That changed everything. Now, interestingly enough, they had therapists around that. They were kind of watching and documenting what was going on. And the feedback, because they wanted to get feedback from the kids, like, what did you think? How was it? How was the experience? And they were more amazed at the fact that it looked like they were on, the news or on TV than anything else. Like, wow, are we really broadcasting to New York through the TVs? That type of stuff. Not that Slash was sitting there talking to them and playing music. But anyway, we learned at that moment the power of technology with these children and what we could do to reach them. So with that, Jack, why don't you talk a little bit about how technology has been used at road recovery? And yeah, thanks.
Yeah, we have a pretty interesting use case. We've been operating at nonprofit road recovery for 20 years, doing after-school programs for young people facing a variety of adversities. We had an amazing state-of-the-art recording studio where the kids would do projects, sometimes in collaboration with famous artists like Slash. And we then unfortunately hit 2020. And I was really following the COVID news very carefully. And I think I started a little early. It was March 8th. And I'm like, I got to get my stuff out of the office and pack up. And, this is going to happen. I remember walking, our office was just a block away from here, walking past Wolfgang's. And I saw all these people at the bar. And I'm like, don't they know what's happening? And I didn't think this was going to be a few weeks. I thought it was going to be, months, if not years. So I remember went home and it literally shut our facilities. We stopped all our programs. So I'm sitting on my couch worried, oh my God, these kids are in isolation. The stress levels are going through the roof. How are they coping? I don't know if they're drinking, drugging at home. It was very concerning. And the schools hadn't figured things out yet. So as I learned in road recovery, what do? You call for help. And I called Todd. And I explained where we're at right now. And he said, well, I'll call Cisco. They're my friends. And I said, okay, let's see what they have. And you mentioned WebEx. And I was like, WebEx? I was like, is that going to be like telepresence where there was this delay with Slash? It wasn't in real time. And he's like, no, it's much better now, Jack. And then I remember worried about security because you guys remember the Zoom bombing that was going on. And at that time, we actually had a contract, a grant from the governor's office, the Office of Addiction Services and Supports. They're called OASIS, right? And they were very concerned about security for the kids. But you said, no, it's secure, end-to-end encryption. So we did the scope of work change and requested to OASIS if we can start working virtually. And I'm telling you, by the end of March, we set up the whole account with WebEx assigned. We had a number of mentors that were available to us virtually, all sitting at home. And we had a number of kids either in our standalone program or at selected youth clubhouses, which I'll explain in a moment, where their oversight people would all come on. And we started with the peer group meetings. That's where the young people and the staff would share their ups and downs of what was going on in their lives. And thankfully, the mentors who had been through a lot of these experiences would give, their solutions or suggestions. I myself went on there, and not only was I worried about COVID, my diabetes was going through the roof. How am I going to get my medicine and all that? So what kids were saying back to me was like, or thinking, well, the grass is not always greener on the other side. This diabetic, well, he's got 10 fingers, 10 toes, but maybe what I'm going through is not as bad. So that's what we did with peer support. And then we did a small scale music instruction that we would usually do in person. Then we're going to run out of money. Oasis said, our grant's going to end. Try the federal government. I'm like, which one? Which part of it? And they said the U.S. Department of Justice. So I learned very quickly to write grants. The U.S. Department of Justice. I sent out 2 grant submissions, locked myself in the room, get that done. Gene was a big help. And lo and behold, later that year, I got a first email from the then AG William. William Barr emailed, and he's like, congratulations, you won an award. And then the next week, I got another email, congratulations, you won an award. And I'm like, oh no, how are we going to scale up? It's like the Gene and Jack show. How are we going to do this? we collaborated, we increased the number of subscriptions, and what happened is we aligned ourselves with programming with all these youth clubhouses. So Oasis governs these youth clubhouses. They're in all 10 Empire zones of New York State, and they are free for kids to go to after school generally. They are safe environments where they receive levels of support. So Road Recovery was that extra after school activity that they would get involved in.
So going virtual was a game changer for us. One, working remotely. A lot of these kids were working off their phones or at home. But we always say there's no cookie cutter approach to when we work with the kids. We really come to them, meet them where they're at. And that was put to the test. And what we discovered in the virtual during the height of COVID was youth that we had relationships with were not putting on their phones, or they were staying muted, and they were communicating with us through chats. We couldn't figure it out. And as time went on and they slowly started to reveal to us, and we started to determine that a lot of these kids were living in the worst poverty. A lot of them were living in crazy households where their mother was getting beaten. There was no food. And so we started to deploy the resources through these youth clubhouses that we had and wrap around, because we had those life preserves, we had those life rafts in place in those locations, that we were able to, through those youth clubhouses, to send out whatever the need was that was happening with these kids. And then as time went on, and we all started to settle into this lifestyle, it started to get more and more comfortable. And what started to really happen was amazing was kids in rural areas up near the Canadian border who were so bored walking around in a field were talking to kids in the South Bronx and saying, well, we can't even go out on the street. It's not even safe. And they started exchanging ideas creatively, and a community started to happen. When COVID passed, we were able to then deploy on the ground staff again in these locations. But we realized, wow, we really had something here. And at this point, Zoom had come on board. And the folks at Zoom were all music heads, and they said, we'll allow your engineers to go under the hood and tweak the Zoom model, along with Todd hooked us up with Neat, and we started getting these Neat devices, which just upped the game because of the audio and the camera level between each point was just so sophisticated. It was the quality was just cut through some limited internet access and other such. But what we had was then we had a hybrid program, and we had the ability to where we could actually then really work with the kids and also in real time deploy any type of health services that we could see through the screen or what our staff was seeing or feeling from these kids in these areas, which then led to where we are today with some folks came to us about an app.
Right. So I just didn't want to skip one thing is we wanted to learn what the outcomes were from our program. We hadn't really captured outcomes in the early years of Road Recovery. So through the DOJ, they gave us access to research scientists at NYU, and then the National Mentoring Resource Center gave us applied research consulting, and they developed all those surveys. And ways to do program evaluation that would be
program
effective.
Evaluation, not only to get feedback from the kids, but for the organization, where staff were taking surveys as well. So we saw it as an incredible opportunity, not only to help identify serving the kids better, what's going on in their lives, but more importantly, we who serve them to understand what we needed to do to continue to change and evolve as a better mentorship program. And the research, and I guess it paid off going to NYU because they put a lot of money behind it, and they've stayed with us in National Mentor Resource to help us with that.
So the challenge is these youth clubhouses that we're servicing are from Buffalo to the Hamptons, scores of them, and we were all just taking surveys by paper for a while. But then there's a company called Team Recovery Technologies that pretty much work just with recovery programs. But they said, no, we'll figure out an app for you. And it was amazing because we have it activated now. It's available on Apple and Google Play. And when the kids come in, they can check in. We could check their mood, either like emoji, and if it's like a sad emoji, right? Don't they get an alert to you?
Yeah. So they check in with us We see how they are coming in, say after school. They participate in the program, and at the end there's a debriefing where they're telling us how are they doing at the end of the session. That's coming back to us in real time, but they're also speaking to our staff. And what we've discovered with young people is sometimes they don't want to talk to an adult. Sometimes it's the choice of the adult. So someone who's not in authority, they'll open up to, but sometimes they'll talk to the app. They'll let us know what's going on. So in real time, we're getting information about what's going on with them. And then again, if need be, we have folks on the ground who are licensed professionals to intervene at that moment to help them in real time on that particular day.
Yeah, it was an effort to really meet the kids where they're at, right? They're all on their phones. We made it gamified. So every time they come to Road Recovery Program, they get points. They can trade the points in to get gifts. And we also had the schedule on there, the music projects that we had done. They can access that. But the big thing was for us was the pre-post surveys. And it all gets collected from around the state so the NYU research scientists can evaluate.
I mean, you could see the passion and dedication that these guys have had and have dedicated their lives to helping these kids. And it's inspiring. It's amazing. It's great. When they've brought technology in around the kids, and I can, speak about this, and so can you. Many times it's hard to get our own folks, and we work around technology to use video or turn their video on, right, John? I mean, it's hard to get people to use technology. Us as adults are just in this world. You hand it over to these kids and they see it as a creative outlet. It's absolutely amazing what they create. And during COVID, they were doing music. I mean, within a couple days, they had already figured out the platform. They had figured out how to do video, how to do music, how to put it all together, all this creative outlet. You guys didn't talk about something about the NY Public Schools inviting you to do the field day or whatever it was. I mean, that was pretty huge.
New York City Public Schools Union has asked us. We've done we did a virtual come together program with them, and also then
just something to lift up the kids during the COVID. I also want to mention, remember we asked Ozzy and Sharon Osbourne, they sent a video from their home saying, to encourage the kids to keep going. And then I believe James Hetfield from Metallica sent the video to the kids, and Peter Frampton, Tom Morello.
Once everyone knew that the kids were accessible through us and through the platforms, they started to send these like, hey, hope you're doing all right. And also giving them some tips, like this is what I'm doing to stay healthy during these times. And it really, for a kid in the middle of nowhere to have Ozzy, giving him a shout out and cursing and, tell him not to say fuck you to your mother, listen to your mom and stuff. That's it. But it made such a difference that they felt valued, and everyone in this room, our greatest asset is our youth, and they need our support. And all this is just love. It's validating them. It's telling them that so many of the kids we deal with, they think they're pieces of shit because they've been told that. And we're telling them they're not. They have tremendous value. And we want to elevate them and help them to connect the dots, because at the end of the day, we see ourselves in them, and we know what the confusion is, and we want to elevate their voice and validate who they are. And as we say, as long as it doesn't harm anyone else, game on. We're going to do it, and we can create it. And they've taken us on journeys, and we've created stuff that is never in our wildest dreams would we have ever imagined. And then they give that back to their community. They speak to their community through whatever medium, if it's dance or art or whatever, and they present it however they want. Sometimes it's a full-blown concert, sometimes it's just a dance party, however they want to speak to their community. And the ripple effect that has, of kids talking to kids is without parallel.
I mean, it's amazing, guys. 27 years these guys have dedicated this, what you see right here.
I want to bring up, move on, but I just want to say we are looking for help. We are a nonprofit.
Join the board.
We could tell you stories of what we've stolen and done all sorts of stuff to keep going. But we are looking for partners. And like I said, it is the healthcare world coming together with the entertainment industry. And knock on wood, we've had tragedies, but we've had tremendous successes. And it is because of that partnership that we know who we are and we know who we're not, and we stay in our lane. And it's because of the support that we have gotten from professionals in the healthcare world that we are very sound and we have a safe organization for these amazing kids.
Thank you. Thank you.